Welcome to the deep dive. Today we're pulling back the curtain on a really relentless adversary. It's a disease that can silently decimate livestock herds and, maybe more importantly, poses a serious, often underestimated global risk to human health.
Yeah, it really does.
You might know it as contagious abortion or maybe Bang's disease. Our mission today in this deep dive is really to unpack the complex challenge of brucellosis in cattle. We want to explore its profound impact, on animals, public health, and even global trade, all by drawing insights from the comprehensive sources we've gathered for you.
And what's truly fascinating here, I think, and what we'll probably emphasize throughout this, is how intricately brucellosis embodies this One Health perspective. It's a disease that doesn't just affect animals, it directly connects animal health, human health, and, well, even environmental factors in a really compelling way. It's all linked.
Okay, let's unpack this then. What exactly is bovine brucellosis and what's the culprit behind it?
Right. So bovine brucellosis is while it's a costly bacterial disease, it primarily targets cattle, bison, and swine. But it's a pretty versatile pathogen. It's capable of infecting other species like deer, goats, sheep, horses, and critically, us humans.
Humans, right?
Yeah. In cattle, the vast majority of cases are caused by one specific type of bacteria. It's called Brucella abortus. You can think of it as a tiny, rod-shaped germ. Scientists categorize it as a gram-negative coccobacillus.
Okay.
Historically, it was widespread in the U.S. back from the 1930s onwards. We've actually seen tremendous success with our national eradication program for domestic cattle.
That's good news.
It is. However, we still encounter spillover cases, particularly near the greater Yellowstone area, the GYA. That's because wild bison and elk, they continue to act as persistent reservoirs for the disease. And while other Brucella species can infect cattle in different parts of the world, Brucella abortus is really our primary concern here in the U.S. context.
So what makes Brucella abortus such a formidable opponent? It sounds like it's got some serious tricks up its sleeve.
It absolutely does. I mean, imagine a microscopic invader so tiny it just looks like fine sand under a microscope. It's non-spore forming, doesn't move on its own, and it needs oxygen. It also has this unique cell wall characteristic, something scientists use in diagnostic staining that helps us identify it. But its most powerful trick. That's its crucial facultative intracellular lifestyle.
Okay, here's where it gets really interesting right there. It's a survival strategy. What does that actually mean for how it operates?
Well, this isn't just, a clever trick. It's the master key to Brucella's survival. And it's why it's so hard, practically impossible, to treat effectively in animals. See, once it enters the host, maybe by ingestion or inhalation, it invades the host's own cells or gets taken up by immune cells called phagocytes. But here's the genius, insidious part. It actively prevents the fusion of the phagosome. That's the little bubble it's initially trapped in with the lysosome.
The cell's digestive system.
Exactly. The lysers contains all the digestive enzymes. By stopping that fusion, Brucella essentially builds itself a secret hideout inside the host's own cells. It can then persist and multiply there, completely shielded from the animal's immune system and, crucially, from most antimicrobials. This often turns infected animals into lifelong carriers.
Wow.
This single insight really explains the fundamental challenge in controlling this disease. It's hiding in plain sight inside the very cells meant to kill it.
So it's virtually invisible and untouchable to the host's defenses.
Okay.
And where does it prefer to, set up shop within the animal? Does it have favorite spots?
It does, very much so. It has a very strong predilection or tropism for the placenta and the fetal fluids, especially during the last trimester of pregnancy.
Why there specifically?
It seems to be due to a sugar alcohol called erythritol. It's found in really high concentrations in the placenta and fetal fluids of certain animals, like cattle. And erythritol acts like a specialized superfuel, basically. It really stimulates Brucella growth. So this direct interaction, this preference, is what directly leads to the characteristic abortions we see in infected cattle.
That makes sense. And how long can this stealthy pathogen survive once it leaves a host, say, out in a pasture?
Its environmental survival really varies quite a bit. It can be anywhere from less than a day to, believe it or not, over 8 months. Its longevity is significantly prolonged in cool temperatures, high humidity, and especially in the presence of organic matter like manure or fetal tissues.
Okay.
So, for example, it can remain viable for several months in water, on aborted fetuses, in manure, even on wool or hay, maybe up to a year in feces, and up to, say, 125 days in dust or soil.
That's a long time.
It is. However, the good news is it is sensitive to common disinfectants and high temperatures, so that gives us some tools for control on farms.
Right. Now, this disease isn't just a problem for cattle, as you said. It's a direct threat to human health globally. How do people typically contract brucellosis? This really underlines that One Health idea you mentioned.
You're absolutely right. It's a classic zoonotic disease. There are three main ways humans get infected. The most common is ingestion, usually from contaminated raw or unpasteurized dairy products, think milk, cheese, ice cream, even butter. Less commonly from raw or undercooked meat.
So avoiding raw milk is key.
Definitely. Pasteurization kills Brucella. Second is inhalation of aerosolized bacteria. This is a really significant occupational hazard for farmers, lab technicians, vets, slaughterhouse workers, anywhere the bacteria can get into the air.
Okay.
And third is direct contact, getting infected animal tissues or fluids like blood, semen, placental membranes, vaginal discharges into cuts, scrapes, or onto mucous membranes like the eyes or mouth.
And what are the symptoms in humans? You said they're tricky to diagnose.
Yeah, they really are. Human symptoms are often very nonspecific and flu-like. Think intermittent fever, sometimes called undulant fever because it goes up and down chills, bad headaches, deep fatigue, body aches, joint pain, back pain, and often profuse sweating, especially at night.
So like a lot of common illnesses.
Exactly. And that nonspecificity frequently leads to misdiagnosis, particularly in regions where doctors don't see brucellosis very often. Plus, symptoms can appear anywhere from days to months after you're exposed. They can disappear for a while, then come back, potentially leading to chronic forms that can persist for years if not treated properly.
And what about the more severe long-term complications for people if it's missed or goes untreated?
Well, that's where it gets really serious. Beyond those recurrent fevers, it can cause severe arthritis, often affecting the large joints like knees, hips, ankles, wrists. But it can also hit the spine conditions like spondylitis or sacroiliitis, can be really debilitating. In males, it can lead to inflammation of the testes and related structures. That's epididymoorchitis. Critically, cardiovascular involvement, specifically endocarditis, an infection of the heart lining or valves, is the most severe complication. It's actually the leading cause of death from brucellosis if it's left untreated.
Wow.
Yeah. Infections can also cause an enlarged spleen and liver, and sometimes the central nervous system gets involved, leading to things like meningitis or encephalitis. So you can see how these very nonspecific symptoms mean the true human health burden is probably significantly underestimated globally.
Okay, given this really complex picture for human infection, the critical question becomes, how do we actually prevent people from getting brucellosis in the first place?
Well, prevention really relies heavily on two main pillars: controlling the disease in animal populations and maintaining strict hygiene practices. Key measures for the general public include consuming only pasteurized dairy products and always thoroughly cooking meat. Simple, but effective.
And for those high-risk jobs.
Right. For veterinarians, farmers, hunters, slaughterhouse workers, anyone handling animals or potentially infectious tissues, wearing protective gear is crucial. Good quality rubber or plastic gloves are essential when handling sick or dead animals, tissues like placentas, or when assisting with calving or abortions. And strict biosafety protocols are absolutely critical in laboratories working with Brucella. It's notorious for causing lab-acquired infections.
What about animal vaccination? Does that help protect people?
It does, indirectly. Vaccinating farm animals helps reduce the amount of bacteria circulating, but you have to be careful with the live vaccines used in animals, like RB51. Accidental human inoculation, like a needle stick injury, can actually cause infection in the person. And it's important to note that the RB51 vaccine strain is resistant to rifampin, which is a key drug used for human treatment or post-exposure prophylaxis, so that complicates things. And just briefly, while person-to-person transmission is extremely rare, it has been documented in very specific situations, like sexual transmission from mother to infant during birth or breastfeeding, or through contaminated blood transfusions or tissue transplants, but again, very rare.
Okay. Let's shift our focus back to the cattle themselves.
Yeah.
How does the infection actually unfold inside the animal's body? What's the pathogenesis?
Right, so cattle primarily get infected by ingesting the Brucella abortus bacteria. These organisms are shed in absolutely massive numbers in contaminated vaginal discharges, placentas, and especially aborted fetuses. That's the main source. Infection can also happen through mucous membranes, the mouth, nose, eyes, or even through broken skin. Once inside, the bacteria are quickly taken up by those immune cells, the phagocytes.
But then they use that trick we talked about.
Exactly. They employ that really sophisticated evasion strategy. They prevent the phagosome, the little compartment they're in, from fusing with the lysosome, the cell's garbage disposal. This allows them to survive and multiply within the host cells. basically hiding from the immune system and, again, most antibiotics. This intracellular persistence is precisely why animals often become lifelong carriers and why antibiotics just aren't very effective for clearing the infection in livestock.
So once it's in and hiding, it spreads systemically, right? Where does it go after that initial invasion?
Yeah, after multiplying in the regional lymph nodes near the entry point, Brucella gets into the bloodstream that's called bacteremia and disseminates systemically to various target organs. Think lymph nodes throughout the body, the spleen, liver, bone marrow, joints, and very importantly, the supramary lymph nodes located above the udder and the udder itself.
And back to the pregnancy issue.
Right, it has that very strong tropism, that attraction for the pregnant uterus, especially in the last trimester. Again, and because of the high concentrations of erythritol and steroid hormones there, they act like a growth accelerant. This intense colonization triggers inflammation, necrosis, tissue death, and damage to the blood vessels of the fetal membranes, the allantochorion. This ultimately compromises the nutrient exchange between the mother and fetus, and that's what leads to abortion.
This raises a really critical question for anyone managing cattle.
Yeah.
How does such an insidious disease spread so effectively, not just within one animal, but within and between entire herds?
Yeah, it's truly multifaceted, and this is where control becomes such a huge challenge. Direct contact is definitely the most common way it spreads. Animals get exposed to those highly contaminated vaginal discharges and birth products, placentas, fetuses after an infected cow aborts, or even has a seemingly normal calving.
And other cows just ingest it.
Exactly. Susceptible cows will ingest or lick these highly infectious materials. Then there's vertical transmission, meaning from mother to offspring. This can happen in utero, across the placenta, so a small percentage of calves are actually born infected. These calves might look healthy, but can become silent spreaders later in life.
Wow.
It's also shed in the colostrum in milk, so calves can get infected while nursing. And although natural mating is less common now with AI, Brucella can be shed in semen. So there's a risk during artificial insemination if hygiene protocols aren't absolutely perfect.
Okay, so direct contact, vertical transmission, what else?
Fomites. These are contaminated inanimate objects. Think shared feed troughs, water sources, bedding, and maybe surprisingly importantly, unsterilized surgical instruments.
Well, knee beetles.
Exactly. Needles, dehorners, ear taggers, castration knives, tattoo instruments. If they're contaminated and reused without proper sterilization, that's a very effective way for humans to accidentally spread the disease from animal to animal. It highlights a critical human-mediated risk.
That's a really important point.
Then, in specific regions like the U.S., we have the issue of wildlife reservoirs. As we mentioned, wild bison and elk in the greater Yellowstone area are the last main source of B. abortus. They pose a continuous threat of spillover back into domestic livestock herds that graze nearby.
Right.
And finally, don't forget its environmental survival. The fact that it can persist for months in cool, humid, organic environments, contaminated calving areas, pastures, old aborted fetuses, manure means these places can remain infectious long after the initial contamination event. Ticks have also been mentioned as a potential, though probably minor, vector. The really insidious part of all this is the concept of silent spreaders. Many infected animals look perfectly healthy, but are continuously shedding bacteria in vaginal discharges, milk, or semen. This, combined with the environmental persistence, makes control incredibly difficult.
So given all that, what are the actual clinical signs we might see in cattle? Or is it mostly hidden, like you say?
It's really crucial to remember the insidious nature. Many, maybe most, infected animals appear outwardly healthy. The primary clinical signs, when they do occur, are most obvious in pregnant animals. The most common sign by far is abortion, typically happening between the 5th and 7th months of pregnancy.
Okay.
Interestingly, an infected cow usually only aborts her first calf after infection. But, and this is key, she can continue shedding the organism in her uterine fluids and milk during subsequent, seemingly normal calvings. So, she remains infectious.
Still a spreader, even without aborting again.
Exactly. Other signs you might see include the birth of weak, unhealthy calves, maybe poor conception rates in the herd, or general infertility issues. You might also notice more retained afterbirth, which can lead to uterine infections. Decreased milk production is common, sometimes weight loss too. And occasionally, animals can develop those enlarged, swollen, arthritic joints, sometimes called hygromas, especially on the knees or hocks.
It really sounds like we're only seeing the tip of the iceberg then, if we just look for those obvious symptoms.
That's a perfect analogy. The visible clinical signs are truly just a small fraction of the actual infection status within a herd. This means relying solely on symptoms for detection is completely insufficient. You'll miss most of the infected animals.
Does the disease manifest differently depending on the animal's age or sex?
Yes, age definitely plays a role in how severe it looks. Calves, for instance, can become infected, maybe through milk or even in utero, but they often show no clinical signs at all until they mature and become pregnant themselves. This allows for silent spread within the herd over years. In herds where the disease is endemic, you might even see dramatic abortion storms, where a large number of cows abort over a fairly short period when the infection sweeps through susceptible pregnant animals.
And what about bulls? You mentioned their reservoirs.
Right. Bulls are critical and often overlooked. Their clinical signs are frequently inapparent, maybe just a slight fever, loss of appetite, or general depression, if anything. But the most significant lesion in bulls is orchitis, that's inflammation of the testes. Often it occurs along with inflammation of the seminal vesicles and epididymis. This can unfortunately lead to permanent infertility.
And they shed it?
Critically, yes. Brucella is present in their semen. This makes infected bulls a significant transmission source during natural breeding or, again, through artificial insemination if semen isn't properly screened or hygiene is poor. So, to reiterate, the disease is predominantly subclinical. Most infected animals show no obvious symptoms. They represent that huge hidden part of the iceberg acting as these silent profit robbers through lost production and posing persistent public health risks.
Okay, so if the symptoms are so nonspecific and it hides so well, how on earth do we actually diagnose brucellosis definitively? We can't just rely on seeing abortions.
Exactly right. Clinical suspicion, seeing abortions or reduced fertility is just a starting point. As you said, the signs are nonspecific. They overlap significantly with a whole host of other things that can cause abortion in cattle, like Chlamydophila abortus or Coxiella burnettii, Q fever. So a definitive diagnosis must rely on laboratory confirmation. There's no way around it.
Makes sense.
Right.
What are the key lab methods then? And maybe what are their strengths and weaknesses in finding this hidden enemy?
Okay, we have a range of tools. The gold standard is still bacterial culture.
Growing the actual bacteria.
Yes, it provides a definitive diagnosis because you isolate the living organism. It also allows labs to biotype the strains, which can be useful for tracking outbreaks. For culture, you'd ideally collect samples like aborted fetuses, stomach contents, spleen, lung, or good fetal membranes, vaginal secretions after calving or abortion, colostrum or milk, maybe semen from bulls, or fluid from those swollen joints or hygromas. Postmortem, key tissues are lymph nodes near the reproductive tract or head, spleen, and mammary gland.
Sounds comprehensive. What are the downsides?
The big challenges are that Brucella is fastidious, meaning it's picky and slow growing. It can take 2 to 3 weeks, sometimes longer, of incubation in the lab. It's labor intensive. And crucially, because Brucella is so infectious to humans, all culture work must be done under strict biosafety level 3 or BSL-3 containment conditions. This requires specialized facilities and training, which makes culture impractical and expensive for routine, large-scale diagnostic screening.
Okay, so culture is definitive but difficult for screening. What else?
Well, there's microscopic examination. You can make smears from tissues or fluids, stain them, often using a modified acid-fast stain like the stamp stain, and look for the characteristic small gram-negative coccobacilli. They often appear as single cells or small clusters.
Is that specific?
Not really. It only provides presumptive evidence. Other bacteria can look similar under the microscope and stain similarly. So it's suggestive, but not definitive.
Right, so what's used for large-scale testing then?
That's where serological tests come in. These detect antibodies the animal produces in response to the infection. They're widely used for screening herds and for surveillance programs because they're much faster and cheaper than culture. There are several types. A LISA enzyme-linked immunosorbent assay is very common now. It's reliable, sensitive, and can be used on milk samples as well as blood serum. For dairy herds, the milk ring test, or BRT, has been a cornerstone for decades. It's done on pooled milk samples from the bulk tank, usually every 3 to 6 months. It's a great screening tool for herds.
But does it have limitations?
Yes, the milk ring test can have false positives, especially from vaccinated animals or sometimes due to mastitis. So a positive ring test requires follow-up testing of individual animals in the herd, usually with blood tests, for confirmation. Other common serological tests include rapid screening tests like the card agglutination test, CAT, or the Rose-Bengal plate test, RBPT. These are quick and sensitive, but maybe a bit less specific. Then there's the complement fixation test, CFT, which is often used as a supplemental or confirmatory test to clarify results from screening tests, and it can be particularly useful in differentiating reactions in vaccinated cattle.
What are the general limitations of looking for antibodies?
There are a couple of big ones for brucellosis control. First, most serological tests can't easily differentiate between the different Brucella species because they share common antigens, especially the lipopolysaccharide or LPS. Second, and maybe more importantly for eradication, antibodies can persist for a very long time, sometimes for life, even after an animal might have cleared the bacteria, which is rare, or more commonly after vaccination. So, a positive serological test doesn't necessarily confirm an active infection or the presence of live bacteria. This really complicates test and slaughter programs.
Okay, that makes sense. What about newer methods like DNA testing?
Yes, molecular methods like PCR polymerase chain reaction are increasingly used. These detect the actual Brucella DNA in a sample. They are highly specific, generally more sensitive than serology, and can be designed to identify the genus, Brucella, specific species like abortus, or even subspecies or strains. Real-time PCR offers even higher analytical sensitivity.
Sounds promising.
Yeah.
Any challenges there?
The main challenge can be the potentially low amount of bacterial DNA present in easily obtainable clinical samples like blood serum or milk, especially in animals with chronic low-level infections. This can sometimes reduce the sensitivity compared to testing tissue samples. PCR also requires specialized lab equipment and trained personnel, and it's generally more expensive than serology. So the bottom line is no single test is perfect for all situations. A truly effective diagnostic strategy needs to be comprehensive, often multi-pronged. You might use serological screening for surveillance, followed by PCR or even culture for confirmation of positive reactors, depending on the specific goal and context.
Okay, that's a great overview. Given all these challenges, the intracellular hiding, the silent spreaders, the diagnostic complexities, what are the primary strategies for actually controlling and ideally eventually eradicating brucellosis?
Well, the absolute core challenge, the starting point for any strategy, is acknowledging that there is no economically feasible or consistently effective treatment for infected livestock.
No cure, basically.
Not a reliable one, no. Antibiotic treatment has been tried extensively, but it has high relapse rates, somewhere between 5 and 15%, maybe higher. This is precisely because the bacterium hides inside cells, shielded from both the immune system and the drugs. So, eradication programs simply cannot rely on treatment. They must prioritize identifying infected animals and removing them from the population. It's a shift from individual therapy to population-level management.
Makes sense. So what role does vaccination play in that population strategy? You mentioned RB51.
Vaccination programs are undeniably crucial, especially in areas where the disease is still present or where there's a risk of reintroduction. The RB51 vaccine is the main one used in the U.S. now. It's a live, attenuated, weakened strain licensed for use in female cattle, typically calves between 4 and 12 months old. Importantly, it's usually not given to pregnant animals.
How effective is it?
It's considered about 70–80% effective in preventing infection. More importantly, it significantly prevents abortions, even if infection does occur. By reducing abortions, it dramatically reduces the shedding of massive numbers of bacteria into the environment, which in turn reduces transmission.
I see.
Vaccinated animals need to be officially identified, usually with a specific ear tattoo and tag for record keeping and regulatory purposes.
Are there downsides or risks to the vaccine?
Yes, like any live vaccine, there are some. As we discussed, it poses a risk to humans via accidental exposure, like needle sticks. And although it's designed to be safer, it can occasionally, rarely induce abortions if given to already pregnant livestock. And remember that RB51 strain is resistant to rifampin, which is a critical point for managing accidental human exposure.
Right. Okay, so vaccination helps reduce spread. Beyond that, what biosecurity measures are absolutely critical on a farm level?
Stringent biosecurity measures are really foundational. If you can keep the disease out, you avoid all the other problems. Maintaining closed herds, meaning not bringing in any new animals, is technically the most effective way to prevent introduction, but it's not always practical for producers.
Yeah.
So if you do bring in new animals, strict quarantine protocols are essential. We're talking at least 30 days of complete isolation from the main herd, with thorough testing for brucellosis, and ideally retesting again before they're allowed to mingle. The safest animals to introduce are usually officially vaccinated calves or non-pregnant heifers sourced from certified brucellosis-free herds.
Makes sense. What about general farm hygiene?
Paramount. especially in and around calving areas, which can become heavily contaminated. Regular cleaning and disinfection of these areas is vital. Personnel hygiene, too, wearing sturdy rubber or plastic gloves when handling any birth fluids, placentas, aborted fetuses, or even just assisting with routine calving or abortions, followed by thorough hand washing and scrubbing afterwards. And then, careful management and control of fomites, avoiding shared contaminated feed and water sources between potentially infected and susceptible groups. And, as we highlighted before, being meticulous about cleaning and sterilizing any shared surgical instruments, needles, dehorners, etc. between animals. That human intervention risk is real.
Okay, and what about managing herds where infection might already be present, or for broader eradication efforts?
Right. For existing herds or regional control, herd management practices focus on finding and removing the infection. This starts with surveillance. Routine testing programs are key, like the milk ring test for dairy herds, or blood testing animals at slaughter or livestock markets for beef cattle. The primary eradication strategy globally has been test and call, or sometimes test and segregate. This involves repeatedly testing all eligible animals in a herd and immediately removing, usually by sending directly to slaughter, any animal that tests positive.
A reactor.
Sounds harsh, but necessary. It is harsh for the individual producer whose animals are culled, often with only partial compensation. But from a population perspective, this test and remove strategy is really the only proven viable path to actually eradicating the disease from a herd or region. Infected animals are quarantined, and their movement is strictly restricted, usually only allowed directly to slaughter. In areas like the GYA, wildlife management becomes a crucial and very complex piece of the puzzle. Efforts focus on trying to minimize contact between wildlife reservoirs like bison and elk and domestic cattle, especially during high-risk periods like the spring calving season when wildlife might be shedding bacteria.
That sounds incredibly difficult.
It is. Very challenging politically and logistically. And finally, prompt reporting is vital. Farmers and vets need to notify animal health authorities immediately if they suspect brucellosis, especially if they see unexpected abortions. This allows for rapid investigation and containment if the disease is found. These strategies, applied consistently over decades, are why the U.S. has largely eliminated the disease from domestic cattle, and why countries like Germany are now officially brucellosis-free. But those wildlife reservoirs show that eradication is a long-term, complex undertaking requiring sustained effort and collaboration between animal health, public health, and wildlife agencies.
Let's talk about the money side. Beyond the immediate health concerns for both animals and humans, what's the real financial toll of brucellosis on the livestock industry? You mentioned a figure earlier, $25 million annually just in lost milk production in the U.S. That sounds like just the start.
You hit the nail on the head. It is just the start. The economic burden is substantial, and it's often particularly severe in developing countries where resources for control are more limited, and livestock are even more critical to livelihoods. The direct losses are often the most obvious. Reproductive failures are usually the single biggest economic hit. This includes the loss of calves due to abortions, especially those late-term ones between 5 and 7 months. It also includes the birth of weak or unhealthy calves that might not survive or thrive, plus longer-term issues like infertility and poor conception rates in the cows.
And the milk loss.
Yes, reduced milk production is a very consistent finding in infected dairy cows. That $25 million estimate for the U.S. was just for milk loss, and it highlights how significant just one aspect can be. One study actually found that reduced milk yield accounted for over 86% of the total estimated economic impact in their analysis. Other direct costs include general weight loss or poor condition in affected animals, increased veterinary costs for diagnosis, maybe attempting treatments, managing complications like retained placentas, and of course the costs of the control measures themselves, like testing and vaccination programs.
Okay, so those are the direct hits. What about the indirect costs, the ripple effects?
Right. The indirect losses really show the broader systemic economic impact that extends way beyond the individual farm. There's the immediate loss in market value of infected animals, even if they look healthy, because buyers know the risk. In regions where cattle are used for agricultural work, there's the loss of drought power if animals are sick or cold. The costs associated with culling itself represent a major financial loss for producers who lose valuable breeding stock. And perhaps one of the biggest indirect impacts, especially for countries aiming to export, are trade restrictions. Having brucellosis can severely restrict the international movement and sale of live animals, semen, and embryos. This can have massive consequences for national agricultural economies.
So if those direct costs are already huge, and then you add these harder to quantify indirect costs and trade impacts, the true global cost of brucellosis must be astronomical. and probably largely underestimated.
Precisely. The overall economic burden is undoubtedly substantial, but getting precise global figures is really challenging. And you're absolutely right. The true economic impact of subclinical disease, those silent profit robbers that just drag down production efficiency without obvious signs, is almost certainly largely underestimated in most calculations. That example, often cited from India, estimating losses over Rs 500 crore annually years ago, underscores these often hidden, unquantified costs that just quietly erode profitability and livelihoods until maybe an abortion storm makes the problem impossible to ignore.
So wrapping this all up, what does this deep dive tell us? We've explored bovine brucellosis, a disease that's clearly zoonotic, incredibly insidious, and as we just heard, devastatingly expensive. It really drives home just how interconnected everything is, doesn't it? A bacterial quirk inside a cow cell can impact global trade and human health across continents.
Absolutely. I think we've really highlighted the key challenges. Its unique ability to hide inside cells, the huge problem of asymptomatic carriers making detection difficult, the unfortunate lack of effective treatments for livestock, and the persistent issue of wildlife reservoirs in some key areas. It reinforces that there's no single magic bullet. To truly tackle this, you need a comprehensive, integrated approach. That means stringent biosecurity on farms, effective vaccination programs where appropriate, robust surveillance to find infections early, and decisive test and cull programs to remove the source. And it all comes back to that collaborative One Health approach we started with. You absolutely need public health, animal health, wildlife management, and environmental sectors all working together. It's the only way to build true resilience against threats like this.
So for you, the listener, who's now armed with a much deeper understanding of this really complex challenge, here's maybe a final thought to consider. We know diseases are constantly evolving, and our world is more connected than ever. Looking ahead, what new technologies, maybe better diagnostics or novel vaccines, or perhaps new forms of international collaboration, do you think could genuinely turn the tide against persistent, costly zoonotic threats like brucellosis in the next decade? Something to think about. Thank you for joining us on this deep dive.